Hi, welcome. We're so glad you're here this morning. I'm Kate Breslin, and I'm the president and CEO at Schuyler Center for Analysis and Advocacy. And welcome to our annual State of New York's Children briefing, affectionately referred to by us as SONIC, State of New York's Children. I'd like to start by introducing our team. Our whole team is here today, except for a few folks stayed back in the office in case any of you are emailing, or any of you who aren't here are emailing to say, where am I supposed to go again? Or calling or anything like that. So I'd like to start by introducing our team, and I'll ask, some of our team is here up front, and I'll ask others to wave when I introduce our policy team. So Katie Albitz, there she is, Katie. Crystal Charles, thank you. Nicole Correa, thank you, Nicole. Shoshana Hershkowitz, back there. Some of our folks came in from far away too. Dede Hill. Lara Castle, who's the coordinator of Medicaid Matters New York. Kevin Pang. Kevin, you met Kevin at the registration desk. And Bridget Walsh. And the fabulous James Farrell is here too, helping us with all things tech and otherwise. So we're so excited to be here with you today. This is a chance for us to take a look each year at, we gather data that as it relates to New York State's children. And we feel as though it's really important that we both understand data as we think about policy priorities, and that our legislators and their teams also think about the data. We also have been really engaged in trying to make sure we understand the experiences of people, of real people. So in addition to the data, we work closely with our colleagues and partners and really welcome others in community where we try and learn from people who are having lived experience of poverty or lived experience of challenges with childcare, people who have had experience with the child welfare system and other kinds of issues that we care about. We also really try hard to make sure that we're looking at the intersections across policy and budget issues. So we know, for example, that children and families who are experiencing poverty are much more likely to end up experiencing the negative impacts of the child welfare system. So we can't look at things only in isolation. And I think one of the special challenges of this time of year for those of us who are doing work in and around this building in Albany is that we end up thinking about things in silos. We end up thinking about things in topic areas and budget tables. And we need to keep in mind that we should be thinking about the intersections across the issues. And I've been thinking a lot about the press keeps covering the governor's remarks about we can't spend like there's no tomorrow, because tomorrow always comes. And so what I'm going to invite you to think about is, what does tomorrow and 1,000 tomorrows look like for the kids of New York? And we are going to make the case that we should be investing now for their tomorrows. I think we all can agree that every kid deserves a fair opportunity to be educated and get off to the best start possible, and that the zip code where they grow up should not determine their chances of achieving success. But it can, and it often does. Growing up in certain zip codes is connected to greater risk of being involved with child welfare systems, dropping out of school, experiencing homelessness, and struggling financially, even as an adult. There is evidence about the long-term consequences of child poverty and growing up in high poverty neighborhoods. birth weights are lower, fewer finish school, and more people identify themselves as being in fair or poor health in poor communities. The longer a child lives in poverty or experiences poverty, the worse their adult outcomes are likely to be. Poorer kids make sicker adults. Cornell researchers found that the longer 13-year-olds have lived in poverty, the less efficient their bodies become at handling environmental demands. And while poverty is difficult for anyone, the impact on children can be permanently damaging. Children, especially those under age 5, whose brains and bodies are rapidly developing, need good nutrition, stability, high quality early learning. But the odds are against them in getting those things if they're poor. So one of the things that we've worked on recently is the Child Poverty Reduction Act, which was enacted into law. It passed the legislature with near universal support. 3 legislators only voted against it. And our Governor Hochul signed it. So this is a statute that commits New York State to cutting child poverty in half over the next approximately decade. And Schuyler Center has been thinking about so much of our work sort of under what we think of as an umbrella of child poverty, because poverty and family economic security touch so many components of a person's life. So I'm super excited for our team to share the data that we've compiled today. We have Crystal and Dede here who are going to walk through some of the data. I encourage you to, hopefully you all got a data book when you walked in, and also on the table in the back are some more materials. All of it's available on our website. And then we're excited to have about 20 minutes of presentation and then a conversation with you, among you and among us to kick off the morning. So thanks.
Good morning, everyone. Welcome to State of New York's Children. I'm Crystal Charles, Senior Policy Analyst here at the Schuyler Center, and I am mainly focused on child welfare and child poverty. So let's start with an overview. Just at the highest level, New York is home to 4.1 million children, making up 20.6% of the population. 1.1 million are under the age of 5. And we have a richly diverse population. So more than half of New York children are brown and black. Almost a third of the children in New York speak a second language at home. 37.5% are in immigrant families. Children have also been part of the recent influx of immigrants, making up over 30,000 of the approximately 150,000 immigrants who have newly arrived in New York between October 1st, 2022 and August 2023. Nearly a third of those children, 9,800, are babies and toddlers under the age of 5. Among the top needs of newly arrived families, housing, food, honest work, paying a living wage, just like their new neighbors. Shifting now to our child poverty analysis, simply too many children in New York are living in poverty. 18.1% of children, or over 734,000, live below the federal poverty level. That's a higher percentage than the average of child poverty for the United States. In the Bronx, that jumps to 35%. In Syracuse, it's 46%. In Rochester, it's 42%. Child poverty is impacting communities all over New York, urban and rural, upstate and downstate. Experiencing poverty limits a child's adult success in education, earnings, and health. Poverty also increases homelessness, food insecurity, and child welfare involvement, which we'll explore more in a little bit. For the youngest children, these adverse experiences can impair brain development, leading to lifelong deficits. The experience of child poverty is concerningly unequal. Children in Black, Latino, Asian, Indigenous, and multiracial families experience poverty at much higher rates than white children, a symptom of the multi-generational impact of racism in housing, education, employment, and other systems. The graph behind me illustrates the percentage of children experiencing poverty in each category. For example, 27.4% of Black children in New York are living in poverty. 28.5% of Native American or Alaska Native children are living in poverty. One of the systems where child poverty is intertwined is child welfare. Child poverty is a major driver of involvement in the child welfare system. Family struggle often results in calls to the state central register, which beget stressful and disruptive investigations, and too often unnecessary family separations. Most children placed in New York's foster care system, which is intended as a temporary measure, stay for more than a year. About a third stay for more than 3 years. Nearly 1,000 young people don't return to their family and exit the system alone between the ages of 18 and 21. That's called aging out. These young people often face severe housing insecurity and homelessness. The graph behind me shows the disparity rates in foster care placement. Black children are 5 times more likely to be placed in foster care, and Latino children are twice as likely compared to their white peers. According to the data, Black children are experiencing extreme disparity, and Latino children are experiencing moderate disparity. These disparities have remained roughly the same for as long as they have been measured. They also remain consistent at each step of the child welfare process, from reports to investigations to preventive services. Despite the acute and increasing need for concrete supports, child welfare and other preventive services are woefully unavailable or hard to access. By the time a family has been reported to the state central register, they have fallen through the cracks in other systems: health, mental health, public assistance, housing, and more. Either because they couldn't afford services, were never referred to services, or are on public assistance waiting lists. Additionally, the symptoms of poverty and being rent burdened are often confused with neglect once a child protective services investigation begins. So that includes food insecurity, housing insecurity, inability to pay energy bills in the winter, inability to afford laundry and other basic necessities. Child poverty has such an intricate interconnection to child welfare that it is both what brings families to the attention of mandated reporters and what leads to families becoming unnecessarily entangled in the system when what they really need is support. New York's Constitution states, "The aid, care, and support of the needy are public concerns and shall be provided by the state." With that, I'll pass it off to Dede, who will walk us through some of the other issues impacting New York's children and families.
Thank you, Crystal. Good morning, everyone. It is so great to be together. It doesn't get old 2 years after lockdown. It still feels great to be together. I love this photo of this beautiful child. I love the sentiment of this slide. Allowing children to live in poverty is a policy choice. But I'm more excited about the next slide. okay? Because this kind of says the same thing, but in an affirmative way, right? What this slide shows us is that in about 2 years, in the middle of a global pandemic, the United States and New York was able to cut child poverty in half. Just like that. And, you know, one simple, effective policy was largely responsible. That was the expansion of the federal child tax credit. It was nearly doubled in amount. It directed the largest credits to the lowest income families. And part of the credit was paid out monthly. It was simple and it was remarkably effective. And I will say this is our favorite kind of story here at Schuyler Center. We have been doing this work for 151 years. And for all that time, we've been making the case for effective public policy. It can transform lives. It can build a more just society. And this is an amazing example. So I wish we could just stop here. Unfortunately, what we don't see on this slide is that the federal expansion has lapsed. And in 2023, we saw the number of children across the country and in New York State go right back up. It is now at about nationally 12.4%, as measured by the supplemental poverty measure, and we can talk about that more later, some of the distinctions, but and the state picture is really similar. And for all the reasons that Crystal talked about and Kate talked about, this slide backwards, it makes our hearts sick, right? We know the myriad negative impacts that poverty has on children if they experience it for a little while, and definitely if they experience it in a persistent way. So I will also say the story continues, right? I'm sure many of you are watching the news. There is some good news possibly coming out of Washington, D.C. There are conversations right now about expanding the child tax credit again, not to the extent that it was expanded during the pandemic. So, stay tuned. We're all very hopeful. It could have really, really important impacts. Later, we'll be talking about also how New York State really needs to be playing a role in making sure that we don't slide backwards. I mean, how can we let that happen? Okay. So here's another lesson, another good news story coming out of the pandemic. Weird to say those, sort of two sentiments at the same time, but we learned during the pandemic, or rather it was confirmed to us, that providing uninterrupted access to health insurance improves health outcomes for everyone, particularly for children. During the pandemic emergency, the federal government prevented states from disenrolling anyone from public insurance, so mainly Medicaid and CHIP. And as a result, the uninsurance rates among children fell significantly in the middle of a global pandemic. And notably, when children and adults lose access to public insurance, it's generally not because they are no longer eligible. It is almost always because they missed a deadline, because they missed a piece of paper in the application process. But the impacts can be so significant. It leads to children missing well child visits. There are missed early diagnoses that can be addressed quickly if found early. Missed vaccinations. What this slide tells us is in New York, nearly 80% of our lower income children are covered by Medicaid or CHIP. The governor has announced that New York is going to be seeking a waiver from the federal government that will implement continuous Medicaid and CHIP eligibility for children up to age 6. This waiver, which we expect will be approved by the federal government, it will ensure that New York children have continuous access to health services in the most critical years of their development. This is so exciting for New York children. We are going to be watching this and fighting for this, and really are hopeful that it will get done this year. Let's talk for a second about oral health and children. The challenges around oral health are significant and longstanding. And this is an area of health that is not talked about a lot, but in fact, dental caries or cavities to the layperson, it is and has long been the most common chronic illness in childhood. And that is particularly so with children living in poverty, Black and brown children, children from immigrant families, children with special needs. They experience oral health problems at disproportionate rates due to racism and poverty and other persistent structural inequities. One reason that our children suffer from poor oral health is nearly half the state's children do not see a dentist on a regular basis. I mean, just sit with that, right? I mean, if that were the case with our children going to pediatricians, we would be screaming from the rooftops. We should be screaming from the rooftops about this. So we know from this data that children who are on Medicaid, that not even 50% are seeing a dentist every 12 months. And that number isn't much better with children who are on private insurance. What the American Academy of Pediatric Dentists recommends is that children see the dentist every 6 months. So there's a lot of work to be done in the area of oral health. And Bridget Walsh and our team, we have some solutions for you, so we'll talk about that soon. Let's shift to childcare. And let's talk about how New York is doing in providing access to high quality, affordable, well-resourced, culturally informed childcare. And I'll pause to just say childcare matters a great deal. It is critical for strengthening families. It is critical for family economic security. It helps parents, particularly mothers, be in the workforce. It can reduce parental stress, giving parents the space they need to do all the adulting they need to do, which is much easier when you don't have a toddler with you. Access to early childhood education, it leads to better health, better cognitive, social, emotional outcomes. It's good for our economy. In the last 2 budgets, New York has made some really phenomenal expansions to access to child care assistance, the principal means of support for families trying to afford child care. To be specific, in the last budget, last year's budget, income eligibility limits rose from 300% of the federal poverty level to 85% of state median income. To put a number on that, that's like a family of 3 earning $83,000 can now access child care assistance. We estimate 108,000 children have become newly income eligible for child care assistance this year. And then add to that, 265,000 children became newly eligible last budget cycle. So this is phenomenal. And this slide tells you a little bit about how this looks for an individual family. Imagine 2 years ago, family of 4, they're earning, the parents are earning $15 an hour. working hard. They have been easily paying $40,000 a year for childcare for 2 kids, easily, with no assistance. Now, their bill could be $324 for the year. I mean, think about how transformational it is for that family who can begin to save, can start the college savings, which really is what they need to be doing when their kids are little, right? I mean, so we really can't overstate how significant these expansions have been. I will also say that there remain some serious obstacles. And for those families who cannot access assistance, these historic expansions don't mean much, right? And unfortunately, the families who have the most difficulty accessing childcare assistance are parents in the gig economy, parents who work non-traditional hours, who work fluctuating hours. It is also the case that New York State does not permit access to childcare assistance to some immigrant children due solely to their immigration status. So these barriers are really, we cannot forget these barriers that are having real impacts for real families, but we also at the same time can really celebrate these really significant expansions. I am going to end, I think, on a bit of a down note, which is another really formidable challenge that faces childcare right now is finding and retaining the childcare workforce, right? The heart and soul of childcare. And without a well-supported, well-compensated workforce, all the gains of the last 2 years, they are all in jeopardy. And certainly the state's stated goal of moving the state towards universal childcare, it cannot happen without a workforce. And we hear from our childcare educators, number one issue, they cannot recruit and retain providers when this is the salaries that they are earning. And they also cannot raise their wages. These are the options that our child care providers have in front of them. They can raise tuition on parents who are already paying $15,000 a year or more for child care assistance who cannot pay a penny more. So that's not an option. Or if they are accepting child care assistance from the state, they don't, the rates are set. And while the rates have gone up a little bit, they are not enough to raise wages. So the only way to raise wages in a sustained way that can change the calculus is if we have a permanent line of funding for publicly funded wage supplements. That's it. That's the only option. And we will be fighting tooth and nail to achieve that vision. I did not read the entire budget last night, but I can tell you that it does not appear that there is a permanent line of funding or much funding at all for the workforce, for the childcare workforce. So, all right, we're gonna move to the best part of today's conversation. Let's talk about solutions, right? We have it absolutely within our power here in New York State to make real change in the lives of New York children this year and in the years to come. And we're going to talk about some of those solutions.
All right. All right. I'd like to have our policy team come on up. And please, we're eager to hear your thoughts, suggestions, questions, especially about, either something you heard today or something that's in the data book, especially, or a solution that you might propose. I will say one of the questions that we anticipated I'm gonna answer one question as you're thinking about yours and your questions and your comments, but one of the things that we've already started to get asked is that because we saw it in the State of the State book and a little bit in the governor's executive proposal, is a proposal to dedicate $50 million in one-time temporary assistance for needy families funds, TANF funds, to address poverty in 3 upstate cities, Buffalo, Syracuse, and Rochester, and sort of our perspective on that. And so we have been thinking about, I think we have been thinking about that a little, although we haven't gone in depth into the budget language. As Dede said, we're going with, we'll talk about that tomorrow. But I think it's really important to recognize that the governor recognizes the challenges of concentrated poverty in our cities, which you will see in our data. New York has some of the highest child poverty rates in the nation in some of our cities. And while we think it's extremely important to bolster and support those cities and those communities, we want to acknowledge that it's important to address poverty in systemic and sustained ways across all of our communities, rural, urban, and suburban. And so we are going to be digging in more to that proposal as we move through the budget process. So we welcome your comments, suggestions, questions. Anybody? We have a mic. And it would be helpful to all if you would say your name as you.
Hi, Mary Ann Joyce from Senator Mayor's office. I was going to ask you about, because I don't think you mentioned it until now, TANF, like, did you have specific views on direct assistance, cash assistance, and how that might improve children's lives, and also how does that sort of compare to increasing the child tax credits? Like, are there similarities or differences between those 2 programs?
For sure. So TANF is called what we all call public assistance, just for level setting, what we all call public assistance or TANF. We have actively supported increases in the amounts that families can get, and in the shelter, inclusive of the shelter allowance. So the shelter allowance is the portion of TANF that is supposed to be able to be used for housing. The amount hasn't increased, 20 years? Okay, in 20 years, thank you, Kari. I think, so this is where I would argue we need to do both and. By definition, if a person's eligible for TANF, they're below the poverty level. So it's really important that we provide people with the resources that they need to be able to live. So TANF, inclusive of the shelter allowance, is extremely important. That's not going to move the needle on the percentage of our kids living in poverty, because they're going to still be living in poverty. So we also need to be thinking about how do we do the other things that we need to do, inclusive of the child tax credit. I'll note that last year there was an important improvement to New York's child tax credit. We used to exclude children between the ages of 0 and 3. New York State now allows a child tax credit payment for kids between the ages of 0 and 3. And what New York should be doing is making sure that the lowest income people can get the child tax credit, and increasing the amount of the child tax credit to make it meaningful for folks.
Can I ask one follow-up? So, folks who receive public assistance, are they eligible for the child tax credit, or do you have to be working to get the child tax credit?
So my sense would be that they are probably, because the phase-in for the child tax credit starts at a certain point. So the lowest income people don't qualify. So it doesn't have to do with the fact that they're on TANF. It has to do with that their income is likely too low for them to be eligible for the child tax credit. Because the child tax credit, the full amount isn't available until it doesn't start phasing in until you reach a certain level. If we had a graph, I could show it better. Shoshana's coming with the mic. Thanks, Shoshana.
Good morning, Ricardo Aguirre, Office of Assembly Member Inez Dickens. 2 questions. One, I'm assuming that all the numbers that you showed are not inclusive of the children of asylum seekers presently. Am I correct in my assumption?
So, for the most part, we are using official census data. The one in our data book, kind of right at the beginning, we share an estimate of how many of the newer asylum seekers are children. And you can see the source for that in our calculations if you go to our website and sources. But for the most part, the data that we're looking at is census data, which would be for 2022.
Thank you. And then the second question is there any legislation that your organization is advocating for or looking for support from other it is early in the morning, legislators? I'm done.
Well, I'll say one, and then I'm going to invite the team. But one is, as Dede mentioned, the governor announced that the state will be seeking a waiver from the federal government to allow kids up to age 6 to be enrolled in Medicaid and CHIP for the whole period from 0 to 6. That we are hoping and expecting that means that there's the bill by Assemblymember Gonzalez Rojas and Senator Rook that would do that would be incorporated into the budget. So that's one. And then
Can we just go down the line?
yeah, go down one. top one, top 2.
Okay, so in child welfare, I was referring to those young people who age out. And the budget ask for this year is to raise the amount of the child welfare housing subsidy, which is available to young people. It was raised last year to $725 a month. So this year we're asking for a cost of living adjustment to be included just as part of the automatic calculations for the housing subsidy moving forward. And also another ask for this group of young people is to increase the amount of the Foster Youth College Success Initiative, which supports them should they enter and move through college. So we're asking for the funding to be raised to $10 million this year.
Okay, I'm going to try to limit myself. So I'll focus on childcare. One, really most of this is budget, what we're looking for. So we need a permanent line of funding for the childcare workforce. We also, there is a bill that was vetoed on December 23rd. We refer to it as the decoupling bill. And what this bill is intended to do is to end the state's practice of tying child care assistance to the exact hours that a parent works. And what this looks like for children and for families is if a parent works fluctuating hours, let's say they work in the restaurant industry or they work in the gig economy, and one day they are done with their shift at 2 o'clock, they have to go pick up their child within half an hour, and if that child is napping, they have to wake up the child. If that child is engaged in a really awesome art project, they have to remove the child from childcare. And the next day, maybe their shift ends at 10 a.m. and so the same thing happens. And it's really bad for kids who thrive with consistency in their routines. My kids are really old now, but I still remember how the nap interruption would throw the entire week off. It also means that many of these families just can't find a child care provider that can care for them, because child care providers, they are struggling so hard to make ends meet. They can't staff, right? They have to have the right ratio of educators in the room at all times. They really can't accommodate hours that are shifting every day. So we really need to get this done if we want an equitable child care system that is really reaching all the state's families. And then one more thing that we really need to get done, and this speaks, I think, a little to your question about the newly arrived immigrants in New York State. The governor has been advocating fiercely to enable these families to get work authorization as quickly as possible so they can gain some economic security, which would be good, really for everyone. And as we showed, we've got about 20,000 children who have come with their parents and who are under the age of 12. Those parents cannot go to work if they don't have access to child care assistance. So we need to end the state's exclusion of children from child care assistance due to their immigration status.
Okay, quickly, I'm just going to mention a bill that was actually passed 2 years ago. It still hasn't been funded. We know that one of the things we hear over and over again in healthcare is the lack of workers. And when you're looking at data, one of the things that we find is that we don't always know how many providers there are, where they're located, how many patients they're treating. And the legislature passed and the governor signed 2 years ago a bill that would authorize surveys at re-registration of all healthcare workers, so we could start to track and know more about the healthcare system and workers, so we can target interventions to create more providers. That has not been funded yet, and I didn't have a chance to look totally at the budget last night. But if it's not in there, we're looking at just a few $100,000 probably to finally fund this and get it up and running. So 2 years later, we still haven't started that process of gaining that health workforce data. So funding that would be a really good thing to do now, so that we know in the future where our healthcare workforce is.
Kate stole mine. Medicaid Matters New York, which is the statewide coalition focused on the interests of people who are covered by Medicaid in New York, focuses on a wide array of issues related to Medicaid and the other public health insurance coverage programs. But the one area related to children and families that we are laser focused on this year is the 0 to 6 continuous coverage, which Kate talked about.
Good morning. My work focuses on our child poverty reduction work, and Dede spoke about the importance of refundable tax credits for children and the families in which they live. So my number one is improving the state's refundable tax credits for kids and families, increasing the amount of the child tax credit, we call it the Empire State Child Credit here in New York, and reducing that phase-in so that the lowest income families can receive the full benefit. There is a bill called the Working Family Tax Credit Bill that is a Senator Bernardus, Assemblymember Hevesi bill that would essentially do that and more. And so we are supportive of that and eager to see it move this session.
Wow. Hope you're happy you asked that question.
Yeah, for what you asked me.
Right. Jillian, I don't know, Mike, up front. Thank you.
Thank you. Good morning. My name is Jill Faison, and I'm an attorney for children in Albany County Family Court, and I'm also running for Family Court Judge. So my question this morning is around child welfare, and we're talking about child poverty, and inadequate food, clothing, and shelter is a charge, is a way that a family could be indicated of abuse and neglect in family court. So does the Schuyler Center have any policy recommendations around really not punishing families via the family court system for poverty? And I know that there have been a lot of criticisms around mandated reporting. There's been, I believe, an OCFS revamp of the mandated reporter training. So where are we in the larger field of kind of divorcing poverty from punishment via the child welfare system in family court?
I'm so happy you asked that question.
Tell me everything.
So I'll start with just where we are. The OCFS update to mandated reporter training is definitely live. I think all mandated reporters in the state are required to take it by sometime this year or next year. And I've taken it just because part of research, I guess, but it definitely takes the position of if a family's just struggling, a report doesn't need to be made. You can take other steps, share with them some services that you're aware of, or at least point them to somewhere in the community where they can get support. So that's kind of one piece of that. I also know there's some work going on around re-examining the state's definition of neglect and really figuring out how we can make it more clear, at least in statute, that poverty should not bring a family to the child welfare system. And there's work around mandated reporting as well. So there's definitely lots of stuff in process. I don't think there's any bills quite yet, but some are cooking. So that's part of my work. I'm kind of keeping an eye on it, and when bill language is ready or other proposals are available, we'll be ready to support. But yeah, until then, it's mostly spreading awareness to those that we can, that this is an issue. There are other ways to show up for families that simply need help.
Do we have one more question or comment?
Hi, my name is Michael Williams. I work in Assemblymember Kellis's office, and I had a question about retaining and also finding new childcare workers. What is your guys' thoughts on micro credentials or an associate's or a bachelor's degree? What kind of background do you want childcare workers to have, and how do we make these jobs jobs that you can raise a family on and create a better life?
Is that one of you or is that Katie?
Yeah, I'm gonna start and then Katie's gonna close us out. Katie didn't even know, but she's ready. I think those are such great questions, and there are, Katie's gonna talk about some of the career ladders. I think the only point I wanna make, and I know Katie's gonna make this again, which is we cannot ask our child care educators to do anything more until we raise their wages. The number of child care educators who actually are on public benefits, who are themselves really experiencing tremendous stress associated with poverty is through the roof, and that they can't, they bring that to the classroom, and they are amazing and dedicated, those who have stuck it out, but they just can't, and we hear every day, and Katie's one of them, folks who love the work, who leave the field because they cannot, like in good conscience for their family, the well-being of their family, they can't stay in the field. So number one is we need to raise wages. Then we can talk about, career ladders, we can, and there's a lot of good thinking, and already a lot of the scaffolding is in place, but we need to raise wages. And it's not an economically sound decision, right, for folks to enter the field. All they have to do is look at what their earning potential is, and no matter how many degrees they get, they can barely pull themselves, into a comfortable economic spot. Oh, she's ready.
Is this working? Okay. Hi. So I'm Katie Elpin, I'm a policy and community.
Like too close to the
From the
speaker.
speaker.
Oh. Sure, you can come here too.
There we go.
At the podium, okay, exciting. Hi, I'm Policy and Communication Specialist at the Schuyler Center. I'm also a former toddler teacher from Binghamton, New York. And as Dede said, I couldn't afford to stay in the role that I absolutely loved. The wage compression at the time, which was back around 2015, was such that if you had a master's degree in certification in the center I worked at, you earned $10.50 an hour. I earned $8.25 as a toddler teacher because my background wasn't in early childhood education. And I, in fact, could not pursue further education because I couldn't make my fair, needs. I would say that as we're thinking, first and foremost, about raising the wages of these workers because it's good for children and it's necessary for them to support their families. It's also important for us to be looking ahead when we're thinking about these ideas such as micro-credentials and pushing further credentialization. Is there even a pipeline left? We're hearing more and more that associate's degree programs, which nurture a lot of our early childhood educators, are actually closing at SUNY schools and community colleges because they have no proven pathway to a living wage. And there's really a lot of emphasis on all degree programs furthering the wages of those who complete the program. And if childcare is not able to do that, then as we're improving these wages, we'll be eroding the future pipeline.
So thank you so much for being with us today. And I'm gonna close, reminding you, we certainly agree with the governor about we shouldn't be spending as if there's no tomorrow. In fact, we should be spending mindfully, thinking about tomorrow and thinking about our kids, families, and communities tomorrow, and not putting short-term savings ahead of long-term value. So we're gonna stick around for a while. Thank you so much.
Yeah, that was fun.